Put your headphones if you're on the volume.
I'm sorry.
Yeah, that's all. Hey, appreciate your feedback. Hey, it's an old-time radio joke right there. 743 KOM News Takeover containing COVID. Let's get the governor's physicians. Let me start over.
Hello.
Dr. Felix Cabrera from the Governor's Physicians Advisory Group. Good morning, Doc.
Good morning, Chris. Good morning, Sabrina.
Good morning.
So I know you guys had a meeting last night with the PAG. What can you tell us about the conversation that happened last night, Dr. Cabrera?
Yeah, sure. You know, we typically have a conversation about a variety of topics. Overall, it was, we had FEMA present, and it was just nothing really specific on the agenda with FEMA. It was just more of a general discussion about understanding the status for each side and ensuring that we have open communications with them. Then there was also discussions, of course, about the reopening plans and reviewing the gated process and the criteria that goes with that, which is still very much in discussion, but pretty much, is pretty close to getting finalized. And so that was heavy on the topics.
What can you tell us a little bit more about the criteria and the triggers that are going to be used to determine what we reopen and how many we reopen?
Sure. I don't want to go into too much detail about the overall opening, because then that's going to be, of course, up to the governor, and then also Ricky Hernandez, who's the deputy director for GIDA, who's been working very hard on this whole proposal, and it's very comprehensive and it's really impressive. But it takes a lot of pieces from different states, and including the White House's opening up America Again plan, and really tailoring it to Guam, and so it's pretty thorough and impressive. But the main parts of it, in terms of what is the key criteria, is, we're going to be looking, of course, at the cases of COVID-19, and that it has to be, of course, a downward trend, and that we're really looking over a 14-day period, and right now it looks like we're very much meeting that criteria.
Right. So, Doc, let me just interrupt and ask you, if we went back 14 days, the plan was out, would we have some reopening just based on today and back 14 days?
Again, the cases being only one of 4 major criteria, but if you're talking specifically about the cases alone, I would say we would meet that criteria at this point in time.
Interesting.
Did you go over the 3 other criteria?
Did you go over the 3 other criteria, Doc?
No, you didn't let me finish.
Okay. Sorry. Yeah. Go ahead, Doc. I'm gonna mute myself. Okay.
No.
Oh yeah.
A clarification is always important.
Right.
So,
Yeah. Go for it.
So with the cases, not only the downward trend of the confirmed cases, but also a downward trend in what's called the test positivity rate, and that we're seeing that the amount of tests that come back positive from the amount that we do is at a low number, and that what that really just tells us that we're casting the net wide enough, and that we're testing enough people to try and catch as many as we can, in terms of really understanding the case, what the true case prevalence is on the island. So those two in combination, if they're trending downward, then that reassures us that we really are in a stable position. So that's the cases part. The hospitalization part is the next one, number 2, and that's really basically, it is subjective in a lot of ways, but it's basically saying that the Guam hospitals are able to treat all inpatients without resorting to alternative standards of care that's due to COVID-19 cases. And so this also incorporates, the non-COVID surge that's occurring right now at GRMC, for example. And so it takes all those different parts into account, but in the end, it will be a recommendation from the CEOs of both hospitals to the governor, whether or not that meets, if that criteria is being met. And then number 3 would be testing overall, and that's Guam's capacity to test all people with COVID-19 symptoms, and the capacity to handle if there's another big cluster that pops up, and our ability to handle that. And then number 4 is the contact tracing by public health and their capacity to conduct adequate monitoring of all the COVID-19 cases and tracings of their contacts. I would say the last 2 are probably the 2 most important of the 4, and that we have to be really sure that that those two are met in order to move on to our next stages of reopening.
Okay, so check 1, check 2. Are we like a semi-check on checks 3 and 4?
Yeah, so I would say that the one that's probably still a little bit most up in the air is testing. And what I mean by that is that, yes, we're doing a lot more testing. We've had the capacity to do much more in terms of all of different labs having increased ability. Also, that dependent on the availability of test kits, swabs and reagents and the like. So, but what's even more encouraging is what we expect coming in over the next several days to even next week. And so based on that, we're on a really good trend that we will meet this criteria very shortly is what we expect. And out of the 4 main criteria, that would be probably the one that's probably the bottleneck right now.
Okay.
What can you tell us about the conversation, if you know it all, between the business interests and economic recovery side and the public health side with, for example, Dr. Mike Cruz, who's on the recovery panel of advisors. What's the discussion like in terms of reopening the island? Is it pretty heated, or are people firm? Is there any compromise? What can you tell us about that, Doc?
From my understanding, and again, I'm not fully involved in all that very specific detail, but the reports that I've gotten is that it's extremely cooperative, and I think the business community, they're very much very understanding of what the criteria is, and that it's mainly based on medical data and our understanding from a public health standpoint, and that the business side is more in terms of how they're going to carry out the reopening itself, and with the guidance that public health will have in recommending, the different steps and criteria to reopen. And because the reality is that none of this is going to be a light switch, and this is a dimmer that we're going to slowly raise up, and if it gets too bright too quickly, then we're gonna we can always back off a little bit. But that's why these checks and balances and tripwires are all in place, so that we keep also measuring well once we make we take a new step, that we're vigilant in monitoring what happens after we take that step, and then understand if things were moving too fast, or maybe not fast enough, or that we can actually go a little bit faster. So it's really unclear at this point, but they're very much understanding that. I think initially they were very much focused on dates. What date are we going to open? What days this should happen? What days is not going to happen? And what we all have to really understand, and what it sounds like is the business community is really understanding this much better now, is that we are on virus time. We are not on human time. And what I mean by that is that the virus and how it's and what it tells us and its own timeline is going to dictate when we meet these different criteria, and of course with our efforts. So to give a specific date is we may not meet certain criteria by a specific date. So let's just say when we meet these criteria, then we'll have a good idea of then when things will happen. Not that we say in 2 weeks we have to meet all these 4 criteria. That doesn't work that way. It'll be like, looks like we're probably checked all 4, so let's look at preparing to open in within or start the next steps within 24, 48 hours. I'm not sure what that's just a guess on my side.
But Doc, what happens if we do the partial incremental reopening and then we get positive cases associated with that reopening?
Yeah. So there is going to be a tolerance for some positive cases, because we have to understand the reality that exterminating SARS-CoV-2 from the island is probably not a realistic possibility right now, and that we shouldn't plan that we're going to do that we have to have achievable goals here, and part of that is reopening, because our current state is just not going to be sustainable in terms of how strongly we are we're in this lockdown, so to speak, and we have to allow ourselves a buffer room. So there are going to be some cases that are going to pop up. Basically, what we've been seeing over the past week or so, 1 last night, 3 the day before, 0 the day before that, 2, and so we're trying to figure out what that true number is that we're allowed to go ahead and say that we can be up and down in this basement, so to speak. And we think that number might be 5. Basically, five new cases per day.
Per day, okay.
Yeah, we think don't hold us to that.
Right.
We're thinking that right now might be the good basement number, and the reason why that number might be good is it's basically 25% of what our worst day was. If you look back over the past 6 weeks.
Right.
And so we had 19 in that one day. And so if we say we make 5 a nice round number, then as long as we stay below that and we don't start trending way above 5, then I think we're going to be okay, and that this epidemic will definitely be considered controlled.
Doc, just from a purely medical standpoint, doctor's orders, doctor's advice point of view, do doctors believe that continuing this lockdown and not reopening businesses is the most effective way to kill the curve?
I think if you're saying that to just remain in the exact same state.
Yeah, let's just say that let's just say Chamber of Commerce, Agita wasn't involved in this, and it was just the doctors from a public health medical standpoint calling the shots. Would the doctors recommend to the patients, the people of Guam, that we just need to stay locked down, we need to keep doing exactly what we're doing until we kill that curve?
Yeah, so here's the true doctor answer, and that's that everything we say and do in terms of what we recommend is based on risk and benefit. And so there is risk of staying in this lockdown as well, right? And that's the risk that we have to other non-COVID diseases and chronic diseases that exacerbate. And so there's parts of that we have a lot of concern about as well. So I don't think that would be our overall recommendation, because unless there's a vaccine that we know is just coming and we're waiting for it to come, then maybe that might be the case that we just that we hold off for if it's going to come in the next few weeks or a month. But the reality is, until that happens, which may not be until a year from now, if it ever does happen, right, that we can't, that this way of life may not be sustainable, at least at this point in time. And again, it goes back to that nobody expects this to be a light switch that's turned on. And that,
well, you have a gift with metaphors, Doctor. I think that's a good one. It's not a light switch; it's a dimmer that we slowly illuminate, and then things get crazy. You're back in the dark.
Yep, exactly. Yeah, and then bust out your candles, and we'll stick with that for now.
Mm-hmm. I wanted to follow up on did you? No. Okay. You guys are talking about this reopening of the island. I wanted to know whatever is in place, who's going to, and whether it's restaurants opening and there's social distancing that has to be implemented. Who's going to enforce all of this to ensure that businesses, whatever the rules are actually sticking to them? And will there be repercussions? I mean, is this part of the discussions?
Yes, absolutely, and that's a big part of the discussion last night, in fact. Mm-hmm. And so, the on paper, public health will have a big role in terms of the policing of the enforcement, the police themselves, maybe, and the like. But the reality is that who's going to be the true persons that's going to be policing the businesses? It's crowdsourcing. It's the whole entire public. And they're the ones that are going to probably keep businesses in check and ensure that they're abiding by these. Because if they're not, then they should not patronize these businesses, and then it becomes and then the effects of competition comes into play, and that if a business wants to do well, they're going to have to adhere to this, and that's pretty similar to in terms of health, sanitation and health in terms of these restaurants, right? If there's a cockroach, the community is going to let a person's going to let the public know through social media that they found a cockroach in this restaurant's food, and so there's a component of that as well, and we have to understand that there's a lot of power behind that, but there still has to be an organized part of it, and that's of course going to be, I think, through public health, but I think that is actually truly to be determined. And I won't, speak for Linda and in terms of what her take on that would be overall. But if it's anything like standard food inspection, things like that, it would be probably similar.
Mm-hmm. You mentioned earlier about this non-COVID surge. Did you say it was at GRMC?
Yeah, and so it's primarily been at GRMC in terms of our significantly high census, and so part of that has been a result of a lot of different factors, including the decompression of GMH in terms of preparing for what could have been a massive COVID surge to GMH by itself. But in that process, GRMC has had to take on a lot of the typically ill adult patients that require inpatient service. And what's been tough is that a lot of this has been you could reasonably argue that it's been related to patients not getting a fair amount of them not getting enough adequate primary care and preventative care measures to prevent these diseases from exacerbating these chronic diseases, and then thus requiring inpatient admission. And when all of that happens around the same time, just like in COVID-19, then it can be a significant stress on any hospital. But there are efforts to do what we can. We've GMH has tried to improve their ability to take back some non-COVID cases or start just really doing more non-COVID admissions instead of redirecting to GRMC.
Wait, so the GMH, which was the COVID hospital, is now going to be a COVID non-COVID hospital? Now they're going to.
Well, it's always had non-COVID cases, right? In terms of patients overall. So obviously there's the pediatric,
right? Okay.
And then there are some of the adult patients that are seen in the emergency department that are not COVID. And that are admitted through that process, the normal process. So it's not like it's been completely extinguished in any way. We've never gotten to that point, thankfully.
Yeah.
And so, but I think it's just this pendulum that is just swinging. It's just swinging on its opposite end at this point.
Okay.
Yeah. What I wanted to share also is that what I learned is that GMH had discharged its last of COVID-19 patients, I think as of yesterday, and so their count right now is I think technically zero COVID-19 patients that's in the inpatient setting, which is a great accomplishment. But we know that that's not necessarily a time to celebrate, and that that there could be still more cases that come after this. But it's something that I think it's worth taking pause to recognize that this achievement that I think all of Guam can take credit for.
And when you say that this doesn't include like PUIs, or that is what you're saying?
Yeah, these are the confirmed COVID-19 cases.
So, but they still might have PUIs there?
Yeah, and every day we have PUIs basically. And what's good, and then you see the reports of that basically in that day, in terms of the positive reports, that there's a lot of times zero to only a couple, and the ones that are a few are the ones that come from that are in the community and not requiring admission. So that's been great. But I know we're up against the hour here, but I just wanted to mention that we may be doing a press conference today that's mainly the state surgeon cell, and so being able to address any other questions the media may have directed to the state surgeon cell.
Cool.
And then on top of that, we have some other insights that we want to share in terms of our state, how things are right now in terms of the trends and what our current state is with the COVID-19 pandemic overall.
Okay.
Thank you.
Thanks for the heads up, Doc. And,
okay.
And thank you for your time.
Of course, yeah.
Okay.
All right, take care.
And wash your hands.
Be safe.
Yeah, we will.
Okay, Doctor.
Okay, bye.
Dr. Cabrera, hey, we're taking